to ensure that the deliverables are in place. So today we are demonstrating again another providing funding for specified healthcare benefits is as an entity provides benefits and the subsidy JADEP. And this is a moving target and requires ongoing review and this is where Parkinson's disease from the standpoint of our responsiveness, but it's also an indication of the challenges we face in the health space within our society. So I want to use the of the environment to these, every time we have the opportunity, cancer is a major, even though cardiovascular disease is the primary cause of death, the rate of growth of cancers is actually the fastest growing. It is a major issue. When you look at the data, 2020 Global Cancer Observatory lists colorectal, otherwise, again, they are not. Some 11% of the population with those are just about 7.5. Don't like to go to the doctor and get screened. Bone marrow cancer, adding these categories to the NHF, beyond that of being a fourth, that these are going to be on target. So today for us is a good day for the National Health Fund and for those continue to be as responsive as we can. Important. One other thing before I take my seat the data coming with about 1,600 screening, 9 of the tends to get screened. Not all of them doing all this, because if you look at the consequence of ignorance, not knowing your numbers, as they say. And we have to intervene and disrupt while we provide treatment. We have about going to the doctor is not to be feared. It's supposed to be viewed almost as a life-saving activity. Because early detection, we have to almost indoctrinate our population. I think should participate, be involved, and to encourage nurses and doctors. It's just not a workable formula, no matter how good you think NHF is. And they are good. It is just a difficult task.
Is the largest number of since from 17 to 20. Mr. Jones, like to extend welcome of Jamaica. I mean, late enough because she's always working so hard. We thought she would have missed the press conference, but we want to acknowledge our Senior Director.
Monica Taylor of the Jamaica Multiple Myeloma Support Group. One of the happy, truly on the list. Screening, which might not be so easy for us to know, is that the executive profile, which is off the radio program. I listen to it every Friday.
I don't know if there's going to be done, not right now. That could be quite expensive to make a cancer society and so on that does these tests also.
Nurses Association, I noticed we are gradually putting the cancers on, but as a nurse of ovarian and cervical cancer, overall is, as you said, Minister, add.
A lot of what we can do would be driven directly by our revenue, because low per patient goes through up to about 15 or more conditions being looked a possibility.
Of private pharmacy owners, and association of private pharmacy owners, and assistance for this latest addition. But I'm not asking about these, and the minister did raise this one. Or any
First of all, towards healthcare, we incorporate them under the same umbrella, and similarly the other partners who are not purely clinical, but sad. You don't have your wallet on, I don't have much. We have a cards against purchases at selected locations. I believe there's a pharmacy chain involved. What's the name of them again? The value drug. There are Yeah, but Island Grill and all that, the people's health in those facilities. So those are bringing to the discount card to incentivize persons, but to any other.
Taylor from the myeloma support group. That are 5 new conditions.
All right, thank you so very much. Yes, indeed, your
Conditions as well.
yes, it's noted. What he's speaking of is the comorbidities, and indeed, it's something that we'll look into.
Covered for each condition. Also, the new application form is on the website as well. And we have the new designed form here with all be downloaded and taken to your doctor. Pharmaceutical Society of Jamaica.
The panelists, I listened to your response, but there is another across the island. The blood pressure, the glucose test, you seek, collaborate with you on this program, know your numbers, because we are actually collecting the numbers, we are seeing the numbers as well. So it's not just about the biz. Next month, between the 19th and the 20th, society, our ambition is actually to have a healthy collaborate, and it's the most efficient government agency that I've dealt with. Just wanting to keep it up.
You did marketing at students, that's why I was asking the question. Even for Pharmacy Week.
And from a personal point of view, in the suppliers, access is the new buzzword. And every week, Ministry of Health, the NHF, they are responsive and they are listening. Very good news for us.
Thank you.
Listening, very good news for us.
Thank you. Thank you very much. I think that's it.
Good afternoon. Good morning. At the NHF, my challenge is that we will let them know the information. When you're doing the tour, provide access in their language.
Partnered with the Disabilities Association. This is a unit based at the Ministry of Labor team, the beneficiaries of that program, for to put Louis to community of this particular case.
Taking the lead from the ministry program for improvement of customer service, several focus on customer service, drug serve. We're currently looking at ways in which we can better serve the community of their representatives are here that for me about what it is. Ladies and gentlemen, I think we're at the end of this important card, bringing the total number to disseminating this vital information for organizing a wonderful day, and may we all remain refreshment. Say to the pharmacy owners that today